Neonatal resuscitation. A newborn infant, or neonate, is a child under 28 days of age. Once the baby is born, dry them off with a towel to prevent loss of any heat through evaporation and place baby on a hard, flat surface wrapped up in towel with their chest exposed in draft-free warm environment and cover head. Start the clock, noting the time. The golden minute is when newborns should breathe on their own within a minute of birth, or they will need ventilatory support. Assess the color, tone, breathing, and heart rate of the baby. If the heart rate is less than 100 beats per minute, then you need to use positive pressure ventilation. If anything seen, wipe the airway lightly with towel. If not breathing, but has a heart rate, give 5 inflations using bag valve mask, keeping head in neutral position. Then reassess with stethoscope. If still no increase in heart rate, look for chest movement. If the chest is still not moving, check position of mask with head and jaw position and start ventilating with 2-person support. Consider suction, laryngeal mask, or endotracheal tube. Reassess. If still no increase in heart rate, look for chest movement. Once chest is moving, continue ventilation breaths. If heart rate is not detectable, or less than 60 beats per minute, after 30 seconds of ventilation, synchronicity 3 chest compressions to 1 ventilation. Increase oxygen to 100% and consider intubation if not already done, or laryngeal mask if not possible. Reassess heart rate and chest movement every 30 seconds. If the heart rate remains not detectable or less than 60 beats per minute, obtain vascular or intraosseous access and give drugs according to local policy and guidelines. Resuscitation efforts may be discontinued if there is no heartbeat or respiratory effort after 20 minutes of resuscitation. If the baby is started on positive pressure ventilation with a bag valve mask and is resuscitated, listen to the patient's heart rate, and if it increases to greater than 100 beats per minute, then initial resuscitation efforts are ceased. Initial ventilating gas recommended for term infants is room air 21% of oxygen, where up to 30% oxygen may be used for preterm infants, as 100% oxygen is avoided, as it can be harmful unless initial resuscitation measures are ineffective. Subscribe to the channel for more.